everybody. We are back here live on Brain Chat for COVID-19 Part 2 with Dr. Brandon Brock, and then we have a special guest here tonight with us, Christi Cass. So what's up, everybody? Okay, well, I said what's up. You guys there? Can you hear me?
Yeah, we're here.
Jeez.
We're here, man.
We can't have any more technical difficulties. So I just want to... Last time I didn't introduce Dr. Brock. Dr. Brock is a doctor of chiropractic. He has his doctorate as a nurse practitioner, and he also just got accepted into a PhD program. So congrats to that too, because you're not busy enough.
No. A glutton for punishment, Ryan. A glutton for punishment.
I'm still over here trying to figure out like how to put diapers on the right way, and you're going off into PhD programs.
Hey, can we spend 20 minutes just watching you do that?
No. And then tonight we brought on Christi Cass. Christi, she's awesome. She's a certified health coach, and she also does business and marketing consulting for wellness professionals. And because we're all kind of freaking out, she has some amazing answers for everybody. So we wanted to bring her on. And,
no pressure there.
Yeah. Christi keeps me stable from breaking down. So I was like, Christi, come on.
Yeah, no, this is great. So thanks so much. What I'm going to try to do tonight, because we had so many questions and comments from the first post, is I'm going to try to follow along on the page. I brought another computer with me. So I'm going to let Dr. Brock take over. And what I'd like for you to do, if you can, just kind of give a summary of our last chat. And then while he's going through all that, I'm going to kind of follow the page. So you guys, please feel free to ask questions, and we'll try to stop throughout the course of the talk and answer those questions. So Dr. Brock, take it away.
Just before we even get going, I think it's very important. It's a sensitive topic, obviously, and we don't really want to, we're giving sides of stories. So everybody is really we're trying to give data, and if we get skewed a little bit, or if an opinion comes out, we're trying not to do that, but we're just giving data, and I want people to be informed as well as do the other panelists. So we give this information so that people can be informed, and I think that an informed person is somebody that is empowered, and an empowered person is somebody that can make a decision and not be fearful or do what they need to do in order to deal with their business, okay? And their business means their whole life. And I think last time I really described what these coronaviruses are. And we talked about SARS, we talked about MERS, we talked about, this common COVID. And, we talked about that awesome pangolin, which apparently, is the carrier of this, so to speak. But nonetheless, we talked about the R naught factor, or how many people are going to get this per one person. So here's the thing about statistics and about going through this kind of stuff. If you constantly read, you constantly learn. So here's what we found. It is virulent, meaning toxic, or it can be passed fairly easily. And I told you that it could be anywhere from 2 to 4, maybe up to 5.8. We're probably finding it's a little bit lower. And now what we're finding is that the longer you're exposed to somebody that has it, probably the greater probability you have. Okay, so please, let's do a couple things here. Don't compare it to the flu. The flu has been around. We have passive immunity. Please delete that conversation. We're talking now about a novel virus that we really haven't seen that we know of. And we're talking about how it's being spread. And this is causing a major, regardless of what your opinion is, flat curve, high curve, whatever, it's causing a major economic issue, whether it's taking care of the sick or keeping people out of school. And that is what's making people a bit hysterical. And really, before I even get going, there's a paper that everybody might want to check out. It's called The Evidence Over Hysteria. And the hysteria over COVID-19, and it's on medium.com, and it's written by Aaron Jin. And it gives multiple perspectives of what, putting people, quarantining them means versus, it looks at things very differently. So, but anyway, getting back to where we were, we talked about that R naught, and we talked about different intervals. And I told you, basically the case fatality. How many people are getting this and how many people are dying? So let me explain this. In various countries, they were testing very, very rapidly. So we had a high positive rate, but a low case fatality because the denominator was very high, okay? And I think right now, as of today, we have 4.2 as a case fatality. Now, The case fatality when it's very high because you're not testing many people is going to be a scary thing because everybody thinks that it's very lethal. But now as more testing is becoming available because of the public demand, you're going to see the amount of people being tested and being positive yet not having to go to the hospital. That number is going to get greater. So the case fatality will probably drop. And now you'll see the hysteria go to this. Look at all the people that are, infected. So it'll go from people who are dying to look at all the people who are infected. And I just want to say that you can make hysteria. And again, I'm not giving you my opinion. I'm just telling you, you can get hysterical or you can get concerned either way about this. Now, I told you the case fatality, and that's in the world. So each state has their own fatality. And now I'm going to break it down into age groups. And what I want to do is tell you about vulnerable populations, because I think a lot of people on here are clinicians and they don't know who's vulnerable. And I talked about elderly people a lot last time. I was watching it and I was like, man, I gave elderly people a bad name. What I really want to do is talk about everybody that's vulnerable. And what we're finding out is this. And I'm just going to say something real quick. We are going to talk a little bit about various things that can help. And we're not going to talk about diagnosis. We're not going to talk about treatment. We're not going to talk about, prevention. We're going to talk about things that can maybe make you a healthy person and things that we may be doing ourselves. We're not here to replace medicine. And I'm not just saying that because it's a disclaimer, it's because it's true. So as you look at this, people who are 80 or over, okay, the case fatality is 15%. That's pretty high. Now, here's the interesting thing. If you look at some of the graphs, it will show a graph of each decade. And 15% will go all the way to the end. So it looks like 100% of the people are dying. But if you go down to the bottom, it only says 15%. So please be careful of that. Okay, it's still only 15%. Now that is terrible, okay? But watch how it changes. So if you go 70 to 79, it drops in half to 8% case fatality, okay? If you take it 60 to 69, it drops in half again to 3.6. Now, this is information obviously from China, and I'm not saying it's good or bad. I'm just saying this is what we got, okay? Because it's a novel condition. If you go 40 to 49, I'm sorry, I skipped. 50 to 59, it's 1.3. So if you're 50 to 59, there's a 1.3% chance, case fatality, that you're not going to make it. Okay, how many other conditions are there that, look, you might be able, anyway, without comparing it to other things, and I'm going to be disrespectful. If you're 40 to 49, it's 0.4. If you're 30 to 39, it's 0.2, okay? And if you're 20 to 29, it's 0.2. And then really anybody under that, the only reason why they passed away is because there was other comorbidities that led them to that. And again, I'm not making light of the death of anyone, anybody that's passing away. That's terrible. But I want people to understand really kind of what's going on here. Now, the other thing I want to throw in here is these numbers increase significantly. And so the thing that gives you the greatest risk is cardiovascular disease. So as you have cardiovascular disease, your chances of your case mortality or your ability to live through this is bad. It's not near as good. So those people should likely be identified and taken away from people who may be asymptomatic but deemed positive. Don't get them near, because the longer that the asymptomatic 20-year-old is near the person that has cardiovascular disease that's 70 years old, the longer they're near them, the greater the probability that they're going to end up in the intensive care unit. Now, that's just a fact. I'm not stating what should be done. That's just a fact. Next is diabetes. Now, I live in Texas. How many people in Texas have diabetes? So it's something, I want everybody to understand something real quick. All of the conditions I'm getting ready to tell you all have one thing in common. They're all inflammatory-based conditions, and they all have interleukin-6. So I'll give you an example of what's going on right now. Everybody's taking elderberry. Okay? Elderberry increases the cytokine storm from the alveoli outside to create septic shock. So not all nutrition is really all that great. We need nutrition that will maybe heighten immune responses, but lower the cytokine storm. And so that's kind of what we're going to be talking about. And that is the commonsensical approach of nutrition and diet. And then Christi talking about things about just life and coping. And this is a brand new environment for all of us. Okay. So anyway, just as I get through this, and I don't want to take the whole time up, respiratory illness, every respiratory condition you have is another factor, is another factor, is another factor. And by the way, we're finding out also that people can have the flu, they can have emphysema, and they can have COVID. So there's no rule in this world that says you can't have more than one condition. And then hypertension is yet another one. So when I look at these four things, this is a huge percentage of the population, and this is a lot of our patients if you're a clinician. So if these are people coming in, the very early stages, I had one today, I tested. I mean, a small cough, a runny nose, okay, a sore throat. By the time they get a temperature, they've already had cytokines that have gone to the brain and activated the hypothalamic control of your temperature to denature those proteins. So going back through this, I wanted you to understand that case fatality, but break it down more into who's really vulnerable. And it's not just elderly. It goes significantly down with age. But there's certain people that, and we really don't have the data available to say, what if you're 50 to 59 but have diabetes? You can kind of do that statistical equation, but I don't think we're quite really at that point yet. And the other thing that we don't have is this. What does this infection do in regards to an epitope? And that means, what does it look like in regards to your own tissue? So if you get it a year or two later, what is there going to be? Is there going to be molecular mimicry, and what other tissues might be affected? Like with Epstein-Barr virus or cytomegalovirus, we have all of those kind of down, okay? And then the last thing I'll tell you before I let Ryan jump in is we're seeing a much greater prevalence in males versus females. Now, epidemiologically, that's something that's going to have to be studied. All of this is going to have to be studied. And by the way, Italy's, their information will be different than China's. Where there's greater populations of elderly people versus where they're at in regards to temperature versus where there's more males than females. So what we're going to find is the data and the epidemiological information is going to vary from region to region, okay? So as we go through this, think about this. I would challenge everybody to read that paper that I just talked about, and I'll talk a little bit about that as I go through. And you know, that's kind of where we're at. So we're going to talk about, and then I'll just kind of real quick, Ryan, summarize what we did last time, okay? Virus comes in, mucosal inflammation, we start getting infection, it goes down to the alveoli. It really attacks type 2 alveolar cells, and then those are angiotensin converting enzyme receptors. The S-spike protein attaches on there. It goes in there, and through transcriptional RNA, it goes to the ribosome. We make more proteins, and we make more RNA, and all these proteins and RNA, they bind together, make more virus. It shoots out, goes back into the alveoli, causes vasodilation, plasma comes out, goes into the alveoli, surfactant is diluted. Now the type 1 cells, they die off that have gas exchange, and the alveoli start to collapse, and all the macrophages and all the neutrophils that came in to deal with the virus, they produce cytokines, and they start getting blasted out, and they go into the bloodstream and cause you to have hypotension. You get septic shock, and now the liver, the kidneys, and you get multiple system organ failure. Okay, I said that very quickly, but it's recorded, so you can go back and look at it. So where does like nutrition or medication fall into this? Are we promoting a cytokine storm? By the way, maybe I want to promote inflammation in a condition where there is infection. But in some infectious diseases, the cytokine storm is so big, you go into shock. So these are some things to think about. And this is what the world has been kind of, there's a lot of really bright minds in the world of medicine, nutrition, functional medicine, everywhere that have been thinking about this. So that's the summarization. That's going over the case fatality, and that's kind of getting everybody up to date. So you kind of know where we're at from the physiological perspective and from the, you know, some of the data. Okay, Ryan, so that's
Quick question
kind of the
before we
introduction.
hop to Ryan. Brandon, I want to ask about, you know, autoimmune disease is so prevalent, especially here in the US. Would you consider someone with autoimmune disease to be someone who could be, you know, put them in that same group as those who are struggling with, diabetes and heart disease and so forth, because they're, compromised.
Yeah, that's a great question. So I'm going to be talking to two different groups here. I'm going to be talking to lay people, and then I'm going to be talking to people who understand a little bit about immunology. So listen, in autoimmunity, we have a Th17 response, which is kind of out of kilter, and it's allowing our immune system to be imbalanced. Okay. And some of these are, I'm making too many Th1 responses that gobble things up, or too many Th2 responses that make more, antibody, or our T reg cells are out. And we have some people that are immunodeficient. By the way, I didn't add that to my list of people, but those that are immunosuppressed, like with HIV, AIDS, or just have immunosuppression, they're vulnerable too. So we're finding out that whenever you have this imbalanced immune system, like even a Th17 response, listen, your Th17 responses, which promote autoimmunity, which promote cytokine storms, which really are what is killing people.
Mm-hmm.
You could have one argument, or you could go into hysteria, or you could get panicked, and those Th17 responses go up and increase inflammation to the point to where if you don't have something stopping inflammation, you might become more prone for this. So now we're thinking about mindset and emotional component, and that's why I'm glad you're here, because people need to do this. They need to step back and say, what does this really mean? And we'll get into maybe who needs to be where, what do we need to do for our economy, and how can I contribute and feel good about myself? So I think that autoimmunity is a good thing to bring up, because you're already in a semi-cytokine storm when your Hashimoto's is active, per se.
Mm-hmm.
And now if this condition comes along and gives you more cytokines, all of these cytokines make massive vasodilation. You don't get blood flow to your organs, and organs don't like it when they don't get blood. And they just start to crash. And this is what all the doctors, it makes them crazy. They're like, oh my God, their liver's failing. Oh my God, their kidneys are failing. Oh my gosh, their heart's beating so fast that, they can't keep up because they have heart disease. The ventilator's working, but going into shock becomes very complicated as a practitioner in an ICU. Okay, so rule number 1, try to keep things from replicating. Rule number 2, try to stop transcriptional RNA. Rule number 3, try to stop the infectious coagulation in the alveoli that you cough out. Number 3, stop the cytokine storm or form. And so if you can do all that stuff, or help or promote, then you've just done something miraculous for somebody that might need you. Long answer for a short question.
I think that, I had a similar question to Christi. It goes to the traumatic brain injury patients, but I think you pretty much answered it with that.
Go ahead and ask it.
Well, what's that?
Go ahead and ask it.
Well, I mean, are traumatic brain injury patients going to be more prone to getting an illness because their brain and body just aren't connected as well as they used to be?
Christi, Christi, you can tell us about societies. Traumatic brain injury is huge. If you're trying to teach some of these people to go through things and to live a certain life, and they've got an inflamed brain on top of an inflamed brain, what do you think about that? How's that going to affect the dynamics of their family and population and what they're doing?
Well, for someone who's suffered with that and hasn't fully recovered, right? That's from a physiological perspective, which I think is where Ryan was going with this. I would think that you would be in more of a compromised position.
Yeah. Now, Christi, do you have any experience with traumatic brain injuries?
Kinda.
Okay. She knows a little bit about this, but yes, guys, listen, anytime you're in an inflamed state, if this goes through the blood-brain barrier, it activates microglia, and I'm going to just kind of talk about what we may talk about later on, because we can't talk all night about this, but glial cells usually just clean up after the party, but when there's sustained inflammation, they either activate MH1 or MHC1 or MHC2 type receptors, so they become phagocytic or they become antigen-presenting cells. So we don't know if this condition creates brain autoimmunity or if it creates a phagocytic response where you eat certain things around it. I think time will tell. And we're also finding out that this virus may embed itself in the brainstem and actually change pneumotactic centers or chemotactic centers, and that alters the respiration rate along with your alveoli collapsing. So that's sort of two things together. And if you are compromised because you've had a mild traumatic brain injury, I would say that you're in a vulnerable, compromised state. Stay away from those infected. And the people who are infected that don't know it are the main vectors.
For sure.
Ryan, is there any questions at this point?
No, we have people like chiming in from all over, but no specific questions. So if you guys are cool with it, I say we dive into the nutrition. And, you know, nutrition in the sense of trying to support resilience, making us less vulnerable to getting sick. And then also nutrition on the side of what can we have in our house to get through all this, especially as we're slowly becoming more isolated with the pantry.
That's all you.
Yeah, let's start.
How do we get toilet paper?
Let's dial it back. Besides toilet paper, you know, it's what Christi, any recommendations on food?
Oh man, so many recommendations. And the first one is what not to be doing, right? You know, don't have a cart full of ramen noodles and you know, canned, processed, boxed junk. That's not what you want to go fill your pantry up with right now. I'm a big fan of obviously fresh food, but you know, some people who may be concerned about going out frequently, they may not be comfortable going out every week to get new fresh food. Well, think about the fresh food that lasts longer. Root vegetables, things like carrots and potatoes and onions and garlic and squash, things that will last a little bit longer. Fruits that will last longer, like apples and oranges and lemons, pomegranates, things that have a longer shelf life. Those are great to have around. If you pick up bananas or berries, which are, you know, really good for you, and they've been there for a little bit, toss them in a bag, freeze them. You can then throw them in a smoothie.
I was literally just gonna say something about that. Because my son's obsessed with organic, like blackberries, raspberries. Mm-hmm. They're like $900 for a small container, and if we don't eat them like the first 2 days, it's over. So
well, and it makes you sick, right? I mean, like sick to your stomach, because my daughter loves those too. So I'm a big believer in freeze them. They're not going to go bad, you know. Then you can throw them on you know, if you eat dairy or non-dairy yogurt, or put them in a smoothie. It's great to have around, and then you have it in your freezer. Your freezer is your best friend, right? Make sure you've got frozen vegetables, and I'm not talking just like frozen corn and peas. Okay. I'm talking, let's get some greens in there. Let's get some broccoli, which we're going to talk about the benefits of broccoli in a little bit. Let's get some cauliflower, some asparagus. I mean, they have frozen greens now from kale and spinach, and fill your freezer with things that are actually going to nourish your body and nourish your cells, because that's what's going to keep you healthier, right? That's an important, let me rephrase it. That's an important part of what's going to keep you healthy, right? You're going to be setting yourself up for success and for the best opportunity for success by having, you know, fresh, then frozen, then canned. You want to beware of canned food, which is not all bad, right? It's, you know, canning was developed for a reason back, you know, years ago. But the canned foods that you want to have, you want to look and see, what are they canned in? If you can get BPA free, which is a lining that's really toxic in canned food. If you can get BPA free cans, if it's BPA free, it's going to tell you right there on the can. That's fantastic. So have some canned as some backup. I think having things like meat and protein, seafood, those things, again, you can purchase them fresh. You can also put some in your freezer so that you have it there. It's not, now you're going to have to plan, right? You can't, if you decide at 5 o'clock that you want to have something for dinner that's in your freezer, it's probably not going to work out well, because, you know, I'm not a fan of let's microwave and defrost it. You want to plan ahead. You want to think ahead about what you're going to be, you know, serving your family. Other staples to have around, simple things like simple foods like beans, lentils. You know, these are foods that also stretch. Make soups, they stretch, they feed you for longer, right? You can make get a whole chicken, cut half of it, make a beautiful bone broth, use that chicken, you know, some of it for the actual soup, and you can take some of it off and make a chicken salad or put it on top of a green salad. I mean, you can get really creative and stretch your food and your food dollar, which I think will be kind of an interesting offshoot for some folks, that they learn how to stretch things a little differently than maybe they were doing before, because we live in that, drive-through society, which isn't quite so easy right now, or maybe have you feel quite so comfortable doing so. Eggs are another great thing to have handy. You can breakfast, lunch, dinner. You can also make, in a little muffin pan, little egg bites. Starbucks is big with the egg bites these days. You can make yourself your own little egg bites in muffin pans, toss them in the freezer, pull them out, warm it up in your toaster oven. You don't have to microwave it. So it's healthy, it's nutrition, it's providing your body, look, you want right now to be eating as many healthy foods as possible versus chips, junk, processed, junky, pre-made, frozen meals. Not a fan of those. It's good to have a few, like I guess for backup, but they tend to be high in sodium. If you have a cardiovascular issue, should you really be having something high in sodium, right? It may not be helpful. It may put you more in a compromised place. So if you're gonna freeze meals, maybe make them and freeze them yourself, so then you know what's actually in them and it's not a bunch of chemicals and things like that. Soups, broths, getting the boxed broth. I love having that because that's wonderful if I'm making quinoa or brown rice, to use that as a base. If I made a beautiful, pot of red beans this week. I live down in Louisiana, so we made red beans in the crock pot. I use, organic chicken broth to help season it more and give it a little bit more flavor. Spices are your best friend. Make sure you've got spices in your, dried spices in your pantry and your cupboard, so that you can make your food more interesting, keep your kids interested, right? Because that's the other thing here. If you're at home and you've got young kids, you're probably trying to get a little bit more creative. So yeah, and I guess the other big thing is, I'm looking at my list here, nuts and seeds. Those are great to have, to snack on, to toss on salads, to toss on top of, if you make some kind of casserole or something, put a little, hemp seed on top. If you have a sweet potato, my favorite thing for a sweet potato is taking some coconut oil, just a little bit of coconut oil, squeeze some lemon juice and put some hemp seeds in it, and a little Himalayan sea salt, just a tiny bit. It is like amazing. Sweet, savory, it's interesting. These are all things that are nourishing, that you want to be, just think about, what do my cells need? To keep me as healthy as possible right now, I need to be nourishing my cells. And I'm all about the greens. As much as you can get fresh greens, be, consuming them. That's not just salad, get some kale, get some Swiss chard, get, collard greens. You're home, hop online, get creative with some new recipes. There's some really delicious ways to cook things that we're not accustomed to cooking, but you want to make sure that you're really nourishing yourself right now and not stress eating and having your hands in the cookie jar and the chip bag and all of those types of things.
Christi, does this include whiskey?
So I have to, to that point, this is actually kind of funny. As I shared, I live down here in South Louisiana. I was laughing so hard when I was at one of the grocery stores earlier this week, and I saw a doctor, and the only things he had in his cart were a big old thing of Tito's and like 2 cases of beer. And I'm like, oh man, he's working hard.
Yeah, his office is closed for 3 weeks.
Yeah, so watch the alcohol, right? You don't want to be doing the negative things that could actually be compromising. And we tend to want to kind of self-soothe, right? And so having a couple of cocktails or things like that, we want to be careful about that. You want to make sure you're hydrating as well, drinking.
Well, Ryan, you got a 2-year-old, man. Tell me what's happening in your life before we get more into nutrition. Like, just we got a lot of listeners, and Christi, by the way, that's amazing, because I think people in the midst of this, they need to get creative. And listen, my wife was at Walmart, and she's like, hey, look, I saw people with she watched somebody literally with $500 of ramen noodles, which I don't even know how you do that, and a few other things, just walk out the door. Yeah, I missed a lot of ramen. It's like
I was in
you can
college.
survive
That was a
anything with
lot.
that.
That's a lot of
So,
ramen.
I mean, I'm pretty sure that ramen noodles in college gave me celiac disease, but hey, that's another discussion. Okay, so
That's another conversation.
but Ryan, what I want to know is, and I think what people want to know is also like, what about the day-to-day life? Like you got kids, they're in preschool, they're not, you know, they're 2 or 3 or 4. I mean, what's happening?
Yeah, it's you know,
Like,
it's tough. Life is just weird right now. I think that's the only way to explain it for us. And I had to go to the grocery store yesterday, and I had to remind myself before I walked in there to not do stress shopping. So I made sure I had a list before I went in. And you know, it was really interesting to see what was cleared off the shelves and what wasn't.
yeah.
From a nutritional perspective. But you know, I bought some good stuff. I bought mostly good stuff and a couple bad things, just to hunker away. But life is weird and tough right now. Anyone that has kids, I think they can agree with this. And everybody's at different levels of stress. But our son, you know, they closed his school down for an unforeseen future. And my wife and I both work. My wife's a physical therapist in the ICU here at Grady. They have several confirmed cases. She's not working with the confirmed cases, but I'm 100% sure she's exposed. So we're stressed about that. And just trying to figure out how to keep a 2-year-old
Entertained,
for
right?
the next month because we're restricted with the isolation. We both work full time. So life is just crazy right now.
Ryan, let me tell you something about that real quick. And I got some interesting statistics. Okay. So everybody just hear me out. And you may see me peer down and read. Okay. So the economic cost right now for closing schools, like you just said, in the US could cost anywhere between 10 to $47 billion. That's for 4 weeks. Okay.
Wow.
And can lead to a reduction of practitioners like us by 6 to 19%. These are key healthcare, personnel that are out there and doing their job. And at this rate, we're going to spend more money on shelter in place than if we completely rebuilt our entire acute care and emergency capacity. Now, these are statistics that people have to start looking at other than who's going to die and who's going to live. Because there's more to it than that. There's also the younger generation that has to grow. And there's the thought process that maybe kids going to, and by the way, this is not an opinion, this is a thought, this is something for people to think about. What if kids, who I already showed you the case fatality rate for younger kids, not high, but their infection rate may be high. And if they get it and they come home, and the longer they're around grandma and grandpa, the greater the probability that any of those people I told you, and I told you those compromised people for a reason. So maybe everybody should go to school, as a thought, get tested, find out who's positive. If they're around anybody that is in that high, that high probability category, maybe we should quarantine them. It's just a thought. Instead of quarantine everybody that's healthy, find out who is infected and who isn't and who is asymptomatic and say, hey, look, if you're prone, you can't be around these little kids that have it but have no symptoms. And now all of a sudden, the longer they're around you, the greater the probability is you're going to get infected. So maybe we should keep the separation between those that are prone and those that are going to be asymptomatic. And the virulence is so high, lots of people are going to get infected. But now we've closed down school, and 90% of people don't know how to homeschool their kids. It's just a thought. So as we go through this, none of the countries in the global authorities really right now admire the shelter in place kind of theory. There's a lot of debate about this. And if you look at this is from World Health Organization and some other place. And they're really using some of the data measurements right now because we're finally at a point where we can do that. And they're finding out what's really going to be best. What data is going to show us to where we can get our economy back on track and people back to work that are not vulnerable and can take care of people who are. And I think that I'm not saying that's the right thing or the wrong thing to do. What I'm doing is I'm giving people something to think about. Okay. And that's the whole point of Brain Chat. At least I hope so. Okay. So we're really focused on resolving this COVID-19, I think. And so with continued testing, and last week, if you go back, this is what even started all these Brain Chats is I was complaining there was no tests. And I was saying the denominator is too small.
Yep.
We all know who dies. The numerator is gigantic. The denominator is too small. So the case fatality was artificial. It was not real. And everybody's admitting that, okay? Pretty soon, as we start getting more commercial testing, everybody's gonna find out that the infection rate is higher, the people in the hospital is lower, and the case fatality is gonna go down. Hopefully, as summer gets here, you'll see this thing burn down a little bit. We don't know yet. We don't know how it's going to tolerate some of that. So anyway, with continued testing, measuring, and vigilance about protecting those with underlying conditions. And that's why I told you those people who are prone, they're all our patients. Diabetes, I got a lot. Heart conditions, I got a lot. Hypertension, tons of them. Look, gut and mucosal patients. So what I would say right now, more than ever, those patients need the healthcare workers that are being pulled out because they're taking care of the people who are quarantined or they're quarantined themselves. So
yeah.
Healthcare providers, take care of yourself. Don't become one of these. If you are, stay quarantined. If you're infected, stay quarantined. But if you're healthy and you're vibrant, be protected, follow all the rules and regulations of resilience and not getting infected, and then maybe help, okay? I don't know what the rules are gonna be come next week or what they're gonna make us do. Finally, we look at this in places like Taiwan, okay? They're proactively seeking out patients with severe respiratory symptoms, okay? And see who's tested negative for flu, and then they retest them for COVID. How novel is that? Now, right now, I'm hearing story after story after story. Somebody had an upper respiratory tract infection. They tested negative for flu. They said, you've got a cold. Go home. So they have no idea who has COVID, but a lot of them do. Mm-hmm. And so we have no idea what that denominator really is, right? And it's causing hysteria. And I think that maybe finding out who our vulnerable population is would be maybe something that would be interesting, okay? So when you look at this, the World Health Organization, they released a study on how China responded to COVID-19, and God love them, they were the ground zero. They were just frantically doing what they had to do. A lot of the data comes from that. So I got to be honest with you, I think a lot of it may be skewed. Italy's going to give us different stuff. We're going to get different stuff from the United States as we go. The more we test, the better it's going to be. That's just my thing. Test, 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 and test. Okay. Yeah. They're finding this, ready? And I'm going to eat the words from the last time I talked. I've said that COVID is virulent, and it is, but maybe not as bad as we thought it was. And we're finding out that the longer that you're exposed, and different surfaces make it more prevalent to those who are prone or in the prone categories I talked about. So according to their report, and that is the people who've been researching this, if you come in contact with someone who tests positive for COVID, you have a 1 to 5% chance of catching it. But the longer you stay around them, the higher and higher and higher that goes. So why not find out who has it and separate them from people who are vulnerable? Those are the ones that end up in the hospital with no insurance, and they're spending $30,000 a day in intensive care unit, and now they end up going bankrupt. This is a real problem, okay? So when you look at places like Taiwan, and we're just giving a chip shot right up to the green here to get ready for talking about some of the things that we can do to stay healthy. And I think Christi did a fantastic job of giving us some food. And Ryan, you're telling us about situations where, society is giving us these situations we just have to deal with. It's like, just deal with it, dude. Your kid got to go to school, but they can't go to school. You still got to pay for it.
Yeah.
Okay. So here's where we are. We can all agree on that. Now we have a vulnerable population. The hospitals are typically not taking them unless they're at the end stages. Mm-hmm. What could we possibly do to augment health? Not cure, not necessarily prevent, but what can I do to take an individual and make them healthy instead of unhealthy? Take away the probability of them just with anything. Ron, what do you think about this?
I think, let's do it. I mean, I was interested, we were talking earlier, I'd like to hear about trying to stop some of those pathways along that cascade of inflammation from a specific nutritional perspective, if you got some stuff. And then also, it's really frustrating to hear that elderberry is not this nasty virus's kryptonite, because elderberry seemed to work for everything, and now we're saying you can't take elderberry for this.
Well, okay, so like I'll say, a lot of Th1 stimulators that don't also have the ability to inhibit a cytokine response might be a promoter, okay? And by the way, those are important. But when we have a condition like this where you need a Th1 stimulator to stop the infection, unfortunately, whenever we do that, we create a cytokine storm or a cytokine barrage sometimes. And if we don't, that's why Plaquenil works. Or, some of these anti-malarial drugs, they may be immunosuppressants, but they're stopping the cytokine storm. So when they stop that, people don't go into shock. Okay, so that's a huge deal. And they're finding that that might be the most lethal thing. And so I'm just saying, when we talk about nutrition, we're not talking about really doing anything other than making some of these pathways more difficult for a virus to maneuver its way through. Okay, it's no different than saying, you know what, I don't want to get this condition or that condition or whatever, and I just want to stay healthy. And so I really think, out of respect for the medical community, that we're not promoting, and I say this, we're not promoting cures. But what we're trying to teach people to do is empower themselves, because hospitals aren't taking minimally ill people.
Right.
So as I say that, this is kind of where we go, Ryan. So, I mean, what do you think about brain real quick, and then we'll lead into some nutrition? I mean, how important is the brain in this, Ryan?
I think the brain is absolutely 100% important, and even more important, you mentioned the blood-brain barrier. So keeping integrity of our barrier systems, I believe, is at the forefront of keeping a healthy immune system. So if there's ways to build resilience in that perspective, I'd love to hear it. I mentioned kryptonite. We had someone chime in, and Lennon chimed in and said andrographis is quite possibly
We're going to talk
viral kryptonite.
Dude, it's on the list.
It's on the list. All right, so let's hit the list, man. But yeah, I mean, for me, it's barrier systems. But if the barrier systems get broken, how can we build better resistance and resilience?
And look, this is the reason why Christi was talking about, like, don't use PBAs, because they break barrier systems. It changes aquaporins, and these are things that, cause things to go straight through, like inflammation. So I would say this, as you're picking out your foods, if you know you have certain food intolerances, please stay away from them. It just does not give you the right to go eat, a bunch of stuff that's going to put you in that category of being prone. And listen, for the love of God, be nice to each other. Okay? This is a time period where people can get really argumentative, but if you do that, it really increases your chance of having an inflammatory response to a Th17 mechanism just from a fight with your spouse.
My wife and I argued about how we were putting our socks in our sock drawer today.
Yeah, and you know what? I got to tell you, man, people are getting into arguments over stuff right now that makes no sense.
Ugh.
And so you really got to, like, sit down, and you got to communicate, and you got to talk, and you got to say, listen, man, we got to take this stuff off the table, because my cytokine load can't handle this right now. Okay.
Yeah.
So listen, Rob, when we're talking about what we can do to just maybe give ourselves the ability to control these things. I mean, there's a lot of good people out there that are good at antiviral nutrition. But we want to deal with infestation, right? So, I mean, there's certain masks, you guys that are wearing surgical masks. I mean, come on. There's certain type of masks that, that we can wear, and, they're the ones that are actually solid. And, the surgical masks that have the little folds in them, those things are really not doing anything. So quit acting cool. Okay. Now, if you have gloves, please remember that if you have gloves on and you scratch your nose or pick it, that glove is now contaminated. Or if you touch a surface that is infected, you're now contaminated. So don't act like just because you have gloves on that you're safe all day. So just remember, it's just, you just got to think about those things. But listen, we have to deal with inflammation, and we already know that. We have to deal with cytokines. We have to deal, really, there's interleukin 6 is like the master daddy of all this. Interleukin 1B is genetically translated via NF-kappa B. So NF-kappa B blockers might be really good on this, like vitamin D. It turns into interleukin 1, interleukin 6, and it turns into a bunch of other things, tumor necrosis factors, and it goes all the way down the line, and it starts to create situations where it damages tissue, damages the endothelium, damages the ability to keep albumin in the bloodstream, and it runs out, and now plasma goes out. And listen, it's bad. Okay. So really what I've thought about with modulation is I broke it down for myself, okay, into several categories. And I want to be antiviral. And of course that's preventative stuff. I mean, everybody all over the world is talking about stuff that's preventative, but what can I do? What can I put in my mouth to be preventative? Possibly, okay? What can I do to slow down replication if I do get infested? How do you slow it down? I mean, it's going to replicate. We already know viruses are basically capsid-induced parasites, okay? And if we do get infected and it does get in the alveoli and it does start destroying things, what can we do to support the cells that are being destroyed that make surfactant and deal with gas exchange? And by the way, these are all nutrients that have thousands of papers. There's not really any nutrients that are straight up compared with coronavirus because it's new. But the components of that cascade, there are papers that shows it deals with different parts. So therefore, probably not going to hurt anything, but it has the capacity to help. So I said cell support, and once we say cell support and we say inflammation, now we say cytokine support. We want to keep it down because it can get really out of control. And then again, reduce the cause. And when I say reduce the cause, Ryan, I'm talking about a leaky gut. Christi, I'm talking about insulin resistance. I'm talking about diabetes. I'm talking about cardiovascular disease. I'm talking about immunosuppression, and that's not necessarily HIV or AIDS. I've got a lot of patients that they just don't have good immune systems, and I'm going to show you some things that might maybe possibly be good for potentiating or augmenting immunological function via white blood cell activation so you have natural immunity. So when we have these things, these are the factors that I'm looking at: antiviral, replication, cell support, cytokine support, reducing the cause, knowing the sources, stopping inflammation, and then stopping that virus from maybe translating into a cell and then replicating through transcriptional RNA and then becoming more prolific and then going back into the cell and destroying things. So if I know that story that we started last time, and I can do some stuff to block it potentially along the way, maybe some of my vulnerable population that I maybe have isolated, I can deal with and I can help them, and maybe they don't end up costing tax or their own money, whoever's money, by being in the hospital or maybe being ventilated or maybe even going into septic shock. So Ryan, is there anything potentially, or Christi, anything potentially that you guys could add to that we definitely want to look out for as far as like the things I put in my mouth and I want to deal with?
I think we touched on it a little while ago, and I'd like to dive deeper before you dive or after you dive into nutrition here. But talking about stress management, I think that's really key because stress induces inflammation. If we're trying to keep inflammation down, how can we? And look, our routines, our rhythms, our ritual, they're like out the window right now, right? We've got kids at home. Things are totally different. We're trying to work from home. How can we better manage our stress? And I think that would be, an important element to the conversation.
Yeah, I 100% agree. And then also we had Dr. Duffner chime in and asked about fasting.
Well, I mean, intermittent fasting, if you have an autoimmune disease, you're looking at 3 days, great. If you're looking at blood sugar disorders, maybe 1 day, great. If you're wanting to augment immune responses, there's a lot of different patterns for fasting. I don't think there's a single answer. You would really need to be condition specific. Some people may have no choice. They're fasting because, which is terrible. But yeah, I think fasting, I do a lot of intermittent fasting just because I want to keep my immune system healthy and I want to replenish it. But that's my thing. Okay. So that's outside of this condition. And so if he wants to re-ask that question and be more specific, that would be fantastic. Now, in some people, they're metabolically set up to fail with fasting. it may not work as well. Okay, so anyway, some of these nutrients. So let's say that we are actually inhaling things, okay? So we're going to talk about some things that the literature shows might be possible. It might help. It might be beneficial, okay? Not curing, not preventing, but it might be beneficial for your health in certain areas. Can we all agree on that? Let's not make this a bigger deal, whoever's watching it. If you've got other things to add in, that's great. We would appreciate you to add that in the story. That's part of this so that everybody can read and build. And there's no single one expert on here. I promise you that. So licorice root, very good for mucosal immunity. Okay. Now, again, some people will argue one of these is a Th1 stimulator, one of these is a Th2 stimulator. I get that. I understand. But licorice root in itself is very good for mucosal immunity. Glutamine is really good for mucosal immunity. Okay. diamine oxidase is very good for dealing with histamine responses. And when you get inflammatory cytokine responses that are at the mucosal level, you'll get a mast cell response, and that promotes histamine, and that can cause a prolonged inflammatory response, an alarm response, and that promotes the cytokine barrage. Some of you, I just went over your head. Some of you, I went straight into your brain. That's okay. So with antiviral stuff, you know, I like to look at stuff, and now I look at zinc, and it's been a big one. So zinc might possibly stop some of that translational RNA from happening when it attaches to type 2 receptors. And it also is really good about balancing Th1 and Th2 responses. And it also, just in general, has the capacity, and there's a great study that just came out in 2020, which just recently came out, that it actually impairs replication of the coronavirus family. So, I mean, we're necessarily talking about all stuff that's extraneous. Some of this stuff has actually been fairly researched. Now, how good is the research? That's always questionable, and it's always something we want to check out. So with mucous membranes, you know, I always want to make sure that I'm, you know, doing something to stop TGF beta, like especially down in my lungs, because if they get inflamed, the capillaries can become fibrotic, and glutathione and N-acetylcysteine work beautiful for stopping a lot of that inflammatory response in the lungs, causing fibrosis. And now we lose elasticity and we can't force air out, and we are almost emphysemic. And then whenever you have diluted surfactant and all that pressure around it and it collapses, it makes it just that much worse. And so these people end up ventilated very, very quickly. So maybe glutathione or N-acetylcysteine or mucimist, which we know is all kind of part of the same family, they can be taken and utilized. And we know that whenever all those white blood cells and everything comes into that alveolar sac to fight this infection, it's creating tons of free radicals. So antioxidants are very, very good, and you guys can name them all off, okay? You know, vitamin A, vitamin C, vitamin E, selenium, but we've got a couple of things that just amplify those tremendously, and I'll go through those in a second. So you guys can understand that controlling your mucosal immunity by stopping dysbiosis and maybe giving good probiotics, making sure you don't eat foods that thicken the mucosa so you get, you know, that kind of slimy layer that can actually harbor bacteria. Because remember, a viral response can also lead to a secondary bacterial infection, which is one of the things that people are dealing with. They're getting pneumonia, okay? And of course, a lot of that's viral, but maybe there's a bacterial component. And we found that 1,3,1,6 beta-glucans, and these are part of these synthetic IGs or IGYs, they help with phagocytosis. So they break things up, but they also stop cytokines. This is opposite of what the elderberry does that I was talking about, okay? So stopping the cytokines yet enhancing immunological responses at the mucosal level is fantastic, okay? Some of the short chain fatty acids work really good here, but you know, selenium and zinc work really good as antioxidants. Zinc works really good. Selenium has been really good at dealing with replication, and lysine, of course, also deals with viruses as well. And I'm not going to name any company names here because we're not here to promote anybody. If anybody wants to IM us later on, we can definitely do that. But these are things that are big. Glutathione, antioxidants, selenium, which is one of our antioxidants, diamine oxidase, these things that control zonulin breakdown, vitamin A that deals with that little slimy layer in Sig-A, right? Anything that inhibits histamine responses, and that even includes food if you're very histamine sensitive. And then, you know, really stopping that viral replication, or potentially stopping that viral replication with zinc. Zinc glycinate is possibly preferable, at least in the literature that I've read. All of these things are stopping it right up here. Okay, so are potentially giving you the response or the capacity to physiologically deal with things. As we go down, we have things like sulforaphane. And this is a really interesting one. It stops NF-kappa B that stops the cytokine storm. So the NF-kappa B turns into interleukin 1B, and some people genetically have a problem and they make more interleukin 1B, they make more interleukin 6. their CRP goes up and now they're inflamed and everything goes down. For those of you that are running labs, okay?
So wait, where do we find that?
Broccoli, especially young broccoli. But there's different products that have it, okay? And by the way, that's probably going to be still on the shelf at the grocery store. All right. Anyway, it protects those alveoli that are getting destroyed. It gives them a greater probability of maybe possibly having a longer life cycle. The type 1 cells the type 2 cells, and especially as things migrate back in, those type 1 cells, maybe we're possibly saving them or buying some time. Okay. Now, there's this thing called olive leaf. Okay. So olive leaf, so as that virus really attaches on that type 2 cell and then goes into another cell, and then we get transcriptional RNA. It's a very, unusual virus. It deals with transcriptional RNA. Olive leaf has been shown to possibly neutralize that. So when you talk about something like olive leaf stopping that, and if it does come back around and get in, and sulforaphane neutralizing that, and then enhancing the other antioxidants like A, C, and E, and then you throw selenium on top of that, then just maybe the medications that stop the cytokines and stop transcriptional RNA that they've already come up with, what if you enhance that response? What if? Are you seeing how beautiful it is that it all fits together, and you know the story, and you know where you're at, and you know from A to Z and all the way to septic shock and organ failure? I mean, I think this is the greatest thing ever. So, look, and another cool thing is a lot of these, immunoglobulins that you can take. And by the way, they're looking now at giving IV immunoglobulins as possible treatment. So there's hyperstimulated egg immunoglobulins that you can take for passive immunity in your mucosa. And we're finding that that is actually possibly enhancing white blood cell recovery in this condition. So that's, again, amazing. That's giving you possible immunity, okay? So the olive leaf, I love combining with the sulforaphane. I love combining with the glutathione. I love combining with the zinc and other antioxidants. And I love watching people get better and then controlling their gut, stopping the dysbiosis, making sure their mucosa is nice and clean, and then keeping hygiene around, and then keeping them physically active and stressed down, and then making sure you're getting plenty of sleep, okay? And then listen, the biggest thing is vitamin D activates your natural killer cells. So natural killer cells are the Navy SEALs of the whole thing. They're gonna come in and they're like this, we're just gonna kill whatever we want, whatever we need to. Vitamin D is gonna activate your T regulatory cells so your immune system doesn't get imbalanced in this whole thing. And then it's also going to activate natural killer cells so that you can go in there and actually destroy this thing potentially. So I like to see vitamin D along with some of the other things. So as we go through this, the andrographis, somebody said something about that earlier, and it does this. It stops the cytokine storm. So it's one of those things that potentiates immunity, but actually stops cytokine storm. And it works to proliferate lymphocytes to destroy things. And it works with licorice root to help the mucosal immunity, but does not promote a cytokine storm along with proliferating the lymphocytes. Wow. Okay. So finally, we have the indigo woad, which I think I said it right. As you get stressed out, you get a cortisol response, which can lower immunity. And that is one of the things that deals with hydrocortisone. Okay. And so that can deal with your adrenal response to stress to your immune system. So I'm giving you a lot of things that could potentially possibly help you out in regards to if you're in that prone or vulnerable category. Now, listen, if you have diabetes, take care of it, take your medication. Okay. If you have cardiovascular disease, don't stop taking your medication, take your medication. Go see the practitioner that is taking care of that and make sure that you're under the right care. And always, always tell your practitioner if you're taking any nutrition, tell them that, because there's a lot of interactions between nutrition and medications. So what I would tell all you to do is do this. Get a membership with naturalmedicines.com. I will promote them. I have nothing to do with them, but it's one of the only places I know where I can type in the nutrient and then type in the drug and it tells me the interaction. So for instance, vitamin C, highly interactive with chemo. Okay. Now, vitamin C in this situation might be great at high dosages. So what I just kind of took you on is a quick little, I'm stopping in at the mucosa. I want to make sure that if it's replicating in the alveolar sac, that we do something to deal with free radical damage. What happens if it goes through transcriptional or translation? Do we stop it there? If it comes back in and it's making cytokines, we know that resveratrol, baccalians, turmerics, all of these things can actually lower the inflammatory load. And I told you the things that would push up cytokines and that you might not want to consider, and some of the things that would help even stop possibly transcriptional or translational RNA if you're looking at this from a nutritionalist perspective. And then I talked about the immunoglobulins and the histamine controlling diamine oxidase inhibitors are, these are really important things. And I talked about the antigraphis and stuff like that and the licorice root and all that. So look, I tried to give you just one or two things for each stopping point. And so I think it's really important right now that we just look at the stopping points, and that is getting things in. Protect your mucous membranes. Okay. Second of all, try to stop replication, something antiviral. And there's medications to do that, but there's not a lot. If it gets down in the lungs, what can you do to deal with the free radical damage? What can you do to preserve type 1 and type 2 cells? If it actually goes through and translates and we get translational RNA, what is actually going to stop proteases? A lot of these nutrients possibly help with proteases, okay? So if it does that, fine. Olive leaf is huge, possibly for stopping reverse transcription and protease activity. Olive leaf and sulforaphane together could be magic. If it gets in there and we actually have that cytokine barrage and it gets out, what are you going to do to neutralize it other than something? And by the way, Plaquenil may work great, but it also immunosuppresses you so much that now some of your other hidden conditions now all of a sudden present themselves. So listen, everybody, please stop trying to get Plaquenil when you have no symptoms. All you're going to do is immunosuppress yourself and get something else. Same thing with an antibiotic, like Zithromax or macrolide that might deal with the translational and transcriptional part. Because, what you might be doing is just creating dysbiosis, which creates more inflammation. Let somebody who is trained give you these things when they need to give them to you. Learn nutrition scientifically and at what step it might be beneficial, not just shotgunning it. And if you do this and do the things that Christi has said, and then we talk about stuff like the brain, where we can talk about left brain and right brain activity, left brain activating immune system, right brain controlling autoimmunity and cytokine storms, we can do some stuff now from top down and nutrition inside out, stress and emotion, and start doing some things that put you together as a whole so that you can be an integrated practitioner. And I'm not saying that you should be purely functional or nutritional. And I'm not saying that, medicine cures everything or that nutrition replaces medication, but maybe there's a place where each of these fit together that makes this puzzle come together. And it says, you're a whole person again. You have resilience. And I think that resilience is the one thing that I would say is the most important. So Ryan, take it away.
Well, real quick. What was the website that you mentioned? We're getting a couple.
Naturalmedicines.com.
Naturalmedicines.com.
Yeah, anybody that's a healthcare practitioner that uses nutrition, that has all the randomized controlled studies, all the proof, everything on there that shows that the nutrient has any kind of backing. And I really think that if you use nutrition, you should have some sort of studies to make some claims. I mean, seriously, medicine does that. So nutrition should do the same thing. You don't want to just throw something out because you heard your buddy say it.
Just a couple other quick questions. I put the website in there. What about colloidal silver spray?
Colloidal silver has been used for years as an antimicrobial. As a spray, I don't know. As an IV, I don't know. As an oral solution, I don't know. I know when I would like to use it, I'll use it a lot topically for viruses. Some people do that. It depends on where you're at and what you have, contact with. But colloidal silver, look, the literature has shown they make Band-Aids with colloidal silver on it.
Yeah.
All right. So we all know it's an antimicrobial. It's just a matter of, if you want to use that or choose to use that. And you're not going to turn blue, okay? Like a Smurf.
What about black seed oil?
Black seed or flax seed?
Black seed. Not
Okay.
not flax. Black seed.
Let me jump to the flax first. All
Okay.
of your essential fatty acids are very important in your immune regulatory cascade. You really need to balance these out, and you need to have a higher level in all probability. Everybody thinks that essential fatty acids are just good for brain with DHA or EPA with cardiovascular system, but these things are hugely immunological. But with black seed, I don't know. One of you guys can answer that. And listen, hey, I don't know everything. So I don't know much about black seeds. I can tell you what a black seed looks like. It's black.
Black cumin seed oil. I know it's used for like a lot of different ailments. I just don't know regarding.
Mm-mm.
Are you talking about black pepper?
Black cumin seed oil.
I've never used it. I don't know. If somebody on there wants to add to it, please do. And I'm trying not to be ignorant by not knowing it. I just don't know it.
You don't know? That's cool. So real quick, I want to touch on stress before we wrap this up, but what's the easiest way to start implementing some of these nutritional protocols or supplements into our everyday life? For people that don't know too much about nutrition, how can we get it into our systems, stuff like that?
Do what Christi said first. Food. I mean, look, our kids, 14, 15 years old, they plan every meal on Sundays. They plan the meal. We look at it and I'm like, we can't have this, we can't have that. And everybody's, and so everybody knows what they're allergic to and they're sensitive to. And by the way, go to the gluten-free aisle. It's full of food.
That is so true. As we have 2 gluten-free people in our family. I'm like, well, this is not a problem.
No, it's all there. In fact, it's like gone, 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 gone. Gluten-free everything, gone, 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 gone. So, I mean, we don't really, when it comes to a lot of things, we're just kind of like this. They just dropped the price on gluten-free food. So it's like we plan things and we just make a meal. We don't overeat. We freeze a lot of things. We've learned to eat some leftovers. Our food bill has gone way down. We've learned to conserve stuff. And to be honest with you, my life is no different. As far as that, my calories have gone down and I'm probably healthier and have lost some weight and feel great. Okay. So it's actually kind of taught me a lesson, and that is, zip about half my mouth closed. So, but second of all, Ryan, I would say this: pick out a couple of nutrients. You can get a lot of these on the internet. Now, listen, really, if you want to find a reputable company, you can IM us. And I promise you, we're not going to represent just one company. There's several out there that are very, very good. So if there's one company that has a product that we think is probably better than another, we don't have a problem saying that. But, I would say start out with one nutrient. If you want to throw it in there, that's fine. See how you do. You may not feel miraculous. You may not say, don't take these things and then run outside in the middle of like the ICU and say, I can't be infected. That's not true. Okay. So I would just say, please be responsible. We're giving you a way to possibly decrease exposure and what the exposure would do to you. Okay. I think that's really all we're doing. And again, it's not, I say we're not trying to prevent anything. What we're really trying to do is just make you healthy.
Yeah. Build that resilience. And regarding resilience, Christi, can you touch on some stress coping mechanisms for all of us?
And stress management's key, right? When we have young kids or teenagers or college students at home and our daily routines out the window, maybe we're having to work from home like you are now, and it changes everything. So creating some rituals, some routines that are going to support you through this time is really important. And it's not just, I'm sure you guys have all heard about the importance of a morning ritual, blah, blah, blah. It's not just about that. It's what tools can you have in your toolbox that when you're about here and you're about to explode, what can you go do? First one that always comes to mind for me is breathe, right? If you're not familiar with the 4-7-8 breathing technique, Google it. It's Dr. Andrew. I never know if it's Weil or Wheel, however you say his last name. It's a very simple breathing technique that actually grounds your central nervous system. So you do that, 3, 4, 5 times in a row, you will actually find that everything just sort of tampers down. It's really powerful. Do that in the morning when you first wake up. Do it again before you go to bed. If you're having a rough day, excuse yourself and go into another room and do some deep breathing. It can really take that exasperated, frustrated feeling and tamper it down, which is really important. Get outside, walk, be in nature. That is huge. By the way, you're also going to get some vitamin D when you do that, right? Naturally. Yes, we love that. So get out, get some physical activity. You don't have to go run. Go for a walk. Walk your dog. Your dog needs to be walked. You know, take the stroller, get your kid out, get them some fresh air as well. Being inside the whole time, as long as weather is permitting, is not good for anyone. If you've thought about, starting a meditation practice or a yoga practice, can I tell you right now is a great time to do that. Go to YouTube. There are tons, bazillions of tutorials and meditations and beginner yoga. My daughter was going off to college, and last summer she started doing yoga, and it was all on YouTube on her floor in her bedroom. And now she actually has a yoga practice. She was doing yoga in college. I thought that was so cool. I never would have done that as a freshman in college. But do that. You're taking care of yourself. You're tampering your stress, which is going to help to not increase inflammation, which we all know from Dr. Brock here that, inflammation is about the last thing we want to be increasing while we're going through this experience. Couple last things. One simple thing is, if you may not be a journaler, a lot of people aren't, but if we have all this stuff running around in our head, right? We have all these negative conversations that are happening in our head, things that we are afraid of, things that are ticking us off, that we're frustrated with, people in our life, whatever. You've got to get it out and release it. So before you go to bed at night, get yourself just, pad of paper, write down anything negative that you just need to get out, rip it up, throw it away. Bless and release. Get it out. It's amazing what putting pen to paper will do to release negative emotions and negative anxiety, fears, feeling. It's when you write it down and rip it up, there truly is just a really powerful release. The last thing that I want to bring up here that I think is really powerful is, so many of us are self-isolating, right? We're home, we're by ourselves, or we're with our families that might be driving us crazy. And we're missing that connection, that community, like that just humanness of being people. Hop on a Zoom. If you're accustomed to getting together with a mastermind group or a group of colleagues or girlfriends and having a glass of wine, guess what? You can do that on Zoom. Connect. Make sure you're still connecting and you're still finding community. If you've got a community of people that you were typically getting together with, create a Facebook group. Support one another in there. Find ways to connect and to create community, because right now we need that now that we're having to be virtual. And when we do that and we're not completely isolating in our heads, right? We may have to physically isolate, but if we can emotionally connect, share, and be in community, even if we're not, we're in, I think, 3 different cities right now, right? And we're having a great connection and a great conversation. You need to do that. You need to stay connected to people and not be fully isolated, vegging on your sofa, watching Netflix, eating chips, because that is not a recipe for success, right? But a lot of people will take this as an excuse to do that. So, find ways to connect with others and with whether it's family, with friends, with other colleagues. That community piece, I think, is actually really essential to helping us bring down our stress, as long as, with the caveat, as long as it's a positive community and you're not all freaking out and sharing all the fear mongering and all that kind of stuff, that's not going to be helpful. But have it be a positive, uplifting, inspirational space, because a lot of people are scared. Find ways to connect and look for the positives and create positive, silver linings that will be able to come out of this time.
Yeah. And Ryan, I think that we'll give you the last word. My last word would be, for those of you that are clinicians, take time right now to sit down and maybe take some of the information that we talked about. And let's say that you just want to look at zinc, for instance, okay? Zinc's been around forever. It does lots of things. There's lots of paper that says it's good. There's lots of paper that says it's bad. And by the way, I can find research on anything that says it's the greatest thing ever or the worst thing ever. So please take that with a grain of salt. Read the paper, see what you think about it. But what I would say is find about 5 people that are vulnerable, that you know that are in your patient population. And please listen to this, because this has made a difference for me just today. Find about 5 people that you know are vulnerable. When was the last time a doctor called you or any clinician called you and just said, hey man, how you doing? Never ago. Okay, so find somebody that you know is vulnerable, write something up, make some references, and say, you know what? There's a possibility that this nutrient might be good for you. Let me share it with you. How you doing? I know that, listen, I'm not charging you for this. I know that you don't need to come in right now. I'm just checking on you to see how you are. Are you sick? And then give them ways to get away from this. Ask them how they're doing. See if they're lonely. And then just let them know that you love them. You don't even have to say it by calling them. It is one of the most beautiful connections that you're ever going to have with your patients. Let me tell you something. For those of you that have your practice and it's dropped down like 50 or 60%, if you do this kind of stuff, it probably won't. It will probably rebound. Your patients will be like, this is the only doctor out of all, like your 70-year-old patient that has 13 doctors, he's going to say only one called me, and it was Dr. So-and-so. And you know what he did? He gave me a free gift. He told me a little bit about whatever. He told me how to grocery shop. He told me not to eat this. And they're just little things. They're just little caveats. They're not hurting anything, but they could potentially help that person. So I would just say take the time to not worry and focus on what you could do if you had the time. Everybody's like, if I just had the time. And I'm like, dude, you're quarantined. You got all the time in the world right now. Why aren't you calling people? Pull out your little list. Find your 80-year-old that loves you. Call them up, see how they're doing, talk to them, make sure they're taking care of themselves, and move on. They will love those things. The stories that we've talked about over these first 2 little, I mean, these are really quick. These stories are huge and complicated, and we're not trying to minimalize virology or what any of the epidemiologists have done. Believe me, we're not. We're just doing some little things here to help people in our community, and that's clinicians, maybe contribute back to each other. And the last thing I would say is, in the comments, what we really want is, I know what I want is I want to see some positivity. Okay? If you're ticked off about something, take it easy. Okay? Take it easy. If you're a troll, you're gone. We're going to throw you out. Okay? If you've got something to add to it. Please. Because everybody that looks at this and everybody that reads below will see the growing amount of information, which means that they know more. This is not the entire story. So anyway, Ryan, I just want to say, Christi, you've been amazing. I've tried to do everything I can to contribute to this. I know that maybe we'll do one more of these next week, and I'll talk strictly about brain, because I know a lot of people, this is brain chat, but brain is always the final frontier. We had to talk about the pathophysiology of this and what we can do to maybe help this. And then if we can get to the brain, they can also play its part as well. And, if anybody wanted to know about medications, when we could do that. But I mean, look, that's not necessarily the point. But those are the things that I hope that we can do with this and gain momentum and be positive. And so, Ryan, having said that, I toss it over to you.
Okay, sorry. One last nutritional question, and then we'll wrap this up. And yes, Christi, thank you so much, because it gets tough to remember to do all the other things that we could be doing. My brain, it's just funny, like I just default into the negative when all this stuff starts happening in life, and it gets hard to pull yourself out of it. So the expressive writing I found has been huge. I've used that for myself, because thoughts can be just thoughts, and if you just write them down and get them out, it helps my brain big time. So thank you.
Thank you for having me here. And
yeah, dude, you're amazing.
Part of this.
We want to add as many dimensions as possible. I mean, next time we do this, I've already got somebody else that I may bring in that's very well versed in stem cells. So, I mean, look, we can throw in all kinds of stuff we don't want just the same people talking. Christi's been a great add into this. And Christi, I want to say thank you also.
Oh, thank you.
Real quick, can you just talk about, because we didn't touch on this, IV infusions regarding vitamin C? We had a patient, or someone mentioned that, and
I mean, okay, so here's the deal about IV vitamin C. I mean, you can only take so much orally, or else you're going to get what? You're going to get an explosive experience.
yeah.
It's not fun.
So IV may be a great way to go, Ryan. I mean, there's micronutrient tests that we can do now to look and see how much we have extracellular versus intracellular. I definitely think vitamin C has a huge component of, I mean, a multitude. I mean, listen, we can sit here and talk all weekend about what vitamin C does to the immune. That's why I left it out, because vitamin C is the one thing that everybody didn't want me to really talk about.
Yeah.
Everybody knows that vitamin C is possibly or probably good for a lot of things, including scurvy. Okay. But when you give it IV, you're giving it at a high rate. And just remember, the only thing I would say to people giving IV vitamin C is make sure that you're getting it made in a sterile environment. A lot of people are mixing it themselves and it's not sterile. And I got to tell you, that's dangerous. Okay. I get anything that I would do infusion, I get it made at the pharmacy. Okay. Second thing is, when you're doing this, make sure that you look on something like naturalmedicines.com and you look. I got to tell you guys something. I teach a class at University of Maryland. I do part of the nutrition where I look at the interactions between nutrients and medications. And you would freak out. Just go to naturalmedicines.com and look at how many medications vitamin C might tinker with a little bit. Okay, so please be aware of those things. And so if you're going to give something at mega doses, like if you're going to give, 50,000 milligrams, 50 grams of this stuff, please make sure that you understand what else is in their environment so that you don't create, some sort of collision. I mean, other than that, if you're good at these things and you're trained in IVs and you understand why you do IVs and you have nutrition to support why you do it, go for it. But if you don't do it just because it's cool, and always look at what you're mixing it with. That's all I would say. And it's kind of a safety first kind of thing.
Yeah.
What else you got, Ryan, before we go? You got any other questions?
Would you be able to I tried to keep a list of everything you mentioned just from the nutritional perspective, so I could just create a list for all the viewers. Would you be able to just send me a list and I'll post it of like some of your top nutritional recommendations?
Sure. I can even tell you some of the companies that combine a lot of this stuff together. That way you don't have 50 bottles of things sitting around. Okay?
Yeah, if you want.
And again, I am not here to be, and again, I have affiliation with some nutritional companies, and I'm not here to represent them as a treatment mechanism for a COVID virus or for a coronavirus, because that's not what they're there for either. They wouldn't want me representing them that way. So, in all fairness, if you want some personal stuff, we can talk about that. But right now, yeah, absolutely. I'll be more than happy to give you an ingredient list of things that could potentially be beneficial for somebody. And then if they want to find and search for nutritional companies that have them combined, that's fine. And there's several of them out there that are great. They're not high in contaminants and they have really good third-party testing and stuff like that.
I'll give everybody your cell phone. Everybody call him in like an hour.
Absolutely, Ryan. You know what I'm going to do? I'm going to post all of those salacious pictures I have of you online.
Oh, no. No, don't. My wife and I just fought about socks. We can't get any more fights.
Okay, cool. Your TH17 is fine for today.
Well, cool. Yeah. Thank you guys so much for your time. And thank you everyone here. And please stay safe. And if you have any questions, just shoot us a message on Brain Chat. And we'll do another one soon. So thank you guys so much. And if we didn't get your questions answered, we'll kind of go through and we'll try to do that tonight or tomorrow. So thank you, everybody.
Bye, guys.
Have a great night. Stay safe. Wash your hands.